Children living with untreated cleft lip and palate often experience immense social stigma and serious health problems. For nearly 4 decades, Operation Smile has improved the health and dignity of patients with cleft conditions, helping them to better breathe, eat, speak, and live a better quality of life in greater confidence. Kendra Davenport, Chief Development Officer at Operation Smile, tells us its origins.
38 years ago, Dr. Bill McGee and his wife Kathy traveled to the Philippines. And the purpose of the trip was so that Dr. McGee could improve his cleft lip and cleft palate surgical skills. When they were met with literally hundreds of families who required surgery for their children or themselves, they realized the need was terrific and came back to the United States and really started to work on developing Operation Smile. And from that, the organization grew and grew. Today, as I said, we're 6,000 volunteers strong. We're the only, I think, surgical organization that is entirely devoted to surgery performed by volunteers, which allows us to provide that surgery free of charge. We have about 150 staff, as I said, who work at our headquarters in Virginia Beach. And then we have offices all over the world.
Wow. Your job is to provide the message of just how important this whole operation is.
It really is. And in this day and age, in the United States, if you just take the United States, if you or I need surgery, chances are we'll get that surgery and we'll get it fairly quickly, and we'll go into that surgery confident knowing that we're going to be operated on by a trained surgeon. Very, very few other places that are in the lower and middle income countries can say that. People can't say that. They don't have access to surgery. So our goal is really to make the same quality surgery available to everyone who needs it. And our work focuses on cleft lip and cleft palate, but we're also committed to helping strengthen health systems around the globe so that operating theaters have all of the equipment they need to ensure the safety of those being operated on, so that the surgeons and the medical teams performing those surgeries have the highest quality training and skills to be able to afford patients the best outcomes.
Dr. Ruben Ayala, Chief Medical Officer at Operation Smile, gives us some context.
So we're very, very fortunate to be in a country where if a child within the first 24 hours of their lifetime, they'll be referred to a top-notch craniofacial center with all the opportunities for treatment. But that's not the reality in low-middle-income countries where thousands of children are born every year, hundreds of thousands in fact. So in the United States, usually it's about one out of every 1,000 children are born with this condition. In countries like in regions like Latin America, might be 1 in 700 and 750. In parts of Asia, depending on where, might be as frequent as 1 in 500 children being born.
I asked Dr. Ayala what the psychological effects are of cleft lip on children and their families.
Many of them face the prospect of a whole life if they get to survive through it, with all the problems that come from it, because this is the fact that a child is born with a cleft lip or a cleft palate, it goes beyond a cosmetic aspect. It also impacts the ability to feed, the ability to speak, the ability to engage in society. These children are usually forgotten and left behind, and we're trying to do our very best with our colleagues around the world to make sure that that's not the case. What you have is the inability to speak. So they're normally ostracized, shunned. When the first time I ever saw a child with a cleft, I didn't see one. I saw 300 children at the same time in my hometown of David in Panama, in the country of Panama. I had never seen one. They were hidden. And I asked myself why, at the age of 16, I had never seen a single child with a cleft. And what happens is, obviously, in many societies, there's a stigma associated with clefts. And parents have to work really hard to overcome all those obstacles, give the kids all the love they can, and seek the medical assistance that the children they require in order for them to give them what they need. You can just imagine the enormous responsibility and the hope and the anxiety and the love that parents have around the world for these children, and who will do anything. They will travel days to get to a place where there might be a doctor or a nurse able to deliver some type of opportunity for them. So it's really important for us to have a sense of what, as a society, we can do to continue to support others, and hopefully in doing the generous deeds for others, there's a reward that comes from knowing that you're doing the right thing for people who have very little.
Kendra tells us what Operation Smile does to address this immense problem.
Every year, we typically perform surgery on between 15 and 20,000 patients. Surgery is just one aspect of what we provide people with cleft lip and cleft palate. There's much more to it. There's psychosocial support, there's speech therapy, there's dentistry that's required to really help them conceive a new smile.
Dr. Ayala speaks of the global effects of Operation Smile's work.
We're very proud to be part of an organization called Operation Smile that focuses on the well-being and the opportunities for children, that uses a worldwide power base of volunteers, medical volunteers, to deliver free medical care to these children and yearly in life, and also through training and engagement, deliver health system strengthening capabilities to help communities around the world.
And Operation Smile goes beyond merely performing surgeries.
I think Operation Smile has the largest cleft lip and cleft palate research study underway in conjunction with the University of Southern California and Children's Hospital in Los Angeles. That study is really trying to get at the causes of cleft lip and cleft palate, and whether it's one thing or multiple things, and what factors influence that, whether it's cook smoke and exposure to. We know that compromises mothers and their infants. Women who cook over an open fire are prone to a number of additional diseases, and we're trying to get more information via the study to see if cleft lip and cleft palate are among those things. We have collected more than 17,000 individual saliva samples, and that represents about 7,000 families who have a member of their family with a cleft lip or palate. That research is, I think, truly groundbreaking. And it's starting to get to what Billy McGee, the McGee's son, who is a surgeon himself and operates in Southern California at Children's, he would say it's getting to critical mass, to the point where the research is really able to move the needle and we are able to identify things. So that's very exciting. But as I said, we're not leaving our mission of providing cleft lip and palate surgery to those in need. I like to think of us as expanding, doing what we've always done, which is leave places we operate better than when we arrived. So when I say health system strengthening, helping ensure that we're teaching along the way, so that those local communities, those local physicians, those local clinics, and those local hospitals that we are able to work in, when we leave, they're better trained. They're more aware, they're more knowledgeable, and they're better able to provide the kind of care that you and I take for granted. I think donors will respond when they know that we aren't deviating from our mission, we're strengthening it.
And to them, Dr. Ayala says this.
To our donors, the only thing we can say is thank you. We have been really moved by the fact that even though so many of you are having to deal with the uncertainty and the difficulties of the environment posed by these difficult times and the COVID pandemic, you're still remaining loyal and believe in the cause of taking care of children with these conditions, of giving them a chance to new lease in life. And so all I can say to our donors who are sticking with us even through these difficult times is thank you. We're in awe, and we're committed to delivering for these children on your behalf.
And pulling the story of Operation Smile full circle,
Doug, I would say, I'd love to just say a couple more words about another thing that I think distinguishes Operation Smile, and that is that the McGee family is so involved. They're involved in virtually every aspect of what we do, from board operations and oversight to day-to-day activities. Christy Picaro, the McGee's daughter, is head of our strategic initiative. Billy McGee, who I mentioned earlier, is leading, medical education, and Dr. Bill McGee and his wife Kathy are involved in virtually every aspect of our operations. And yet, the co-founders are still so actively involved as they both approach, their 80s. Really, really sets us apart, and it's what helps us preserve the values, I think, that Operation Smile was built on.
This organization, the values are so strong.
Yes, absolutely. I think COVID has underscored some of the values we try to infuse in everything we do. Empathy, care, compassion, patience, all of those things influence the way we interact with each other in the office and in our fully remote mode, which we're still actively operating in. We have a handful of essential workers going into our Virginia Beach facility, but by and large, the organization on the United States side is still in a completely remote mode. And yet, I don't think the efficacy of our work has changed one iota. In many ways, I think it's helped us focus, but we've worked very, very hard to be as supportive as we can of our teams, our staff, and I think that empathy starts with us. It starts within the organization. Very, very hard to extrapolate that around the world under what are arguably austere and often challenging circumstances if you don't embrace that with your own teams and your own staff. And I think the McGee's lead with that kind of empathetic compassion, and it really is imbued in everything we do and inculcated in the way we operate at HQ and in offices around the world.
It's quite inspiring, really. And
it's an inspiring place. And one of the things I've said recently is we've made a few hires. And again, things just keep moving forward. And I love that, again, about Operation Smile. We didn't let this deter us. And we have hired a few key staff in the development department. And one of the things I lament a little bit is that they have not had the full-on experience of being at our headquarters, being in the office, because the energy in that building when the team is all there is electric. It's empowering. And even on a not so great day, you can feel it and your mood changes because we are changing people's lives. We are. We're changing their families and we're changing the people who receive surgery's lives. And that's moving. It's powerful. And you can feel that in that building. It's a little harder to do when we're all remote on Zoom, but you can sense when we're getting excited. And even during this call, I just got a text from one of our major gift officers who said, I have great news. I can't wait to talk to you after the interview. And that again goes back to our donors because we're able to, really passionately tell our story and why their support is needed. And they passionately respond to support.